This BMORE Lifestyle segment is sponsored by Orthopedic Associates of Central Maryland.
Of course, athletes are hitting the courts and the fields and the ice this time of year, but unfortunately, injuries are always in season. Today, we are here at the Orthopedic Associates of Central Maryland, learning about how to best care for sports injuries this time of year. I'm joined by Dr. Ralph Zade. Dr. Zade, thank you for having us out.
Thank you for having me.
What injuries are sort of most prevalent this time of year, wintertime?
As the winter months roll around, sprains and ligament injuries are common with sports like wrestling, basketball, and lacrosse as we get into the spring. Fractures and dislocations can be common with more traumatic sports like hockey or skiing. Overuse injuries are common as well with sports like swimming or volleyball.
If an athlete doesn't feel right, they've done something, when should the athlete or perhaps the parent sort of be concerned? What rises to that next level?
That's a great question. When there's a trauma, an injury to the lower extremity, and someone has difficulty bearing weight, that's a good time to come in. You want to make sure there's not a fracture or a dislocation or a severe ligament injury. If similarly somebody has a lot of swelling in the joint or difficulty moving it, they should probably come in and get evaluated. Now on the other hand, if there's been some pain that's just been growing over a period of time with no real discrete injury, they could probably try some more conservative modalities like rest from the sport, anti-inflammatories like ibuprofen, icing, and give it a couple of weeks. Often these type of overuse injuries will get better. If not, or if there's just a lot of concern, always err on the side of caution and come on in for evaluation. Do you find that most injuries require surgery? Many patients are worried to come in and see a surgeon because they think a surgeon always means surgery. In reality, as a sports surgeon, most of the injuries that I see are treated non-operatively. Surgery is sometimes necessary, but is usually the last resort and something we only do if someone absolutely needs it.
I imagine the best treatment for an injury is to not have one. What can folks do, what can athletes do, and maybe parents helping athletes to do their best to prevent injuries?
Certainly prevention is key. As this time of year comes where it's cold outside, stretching and warming up is key. Additionally, if you're doing outdoor sports such as skiing or hockey, keeping the fingers and the toes warm and covered is essential. Layering is often a good way to be able to adapt to changing temperature and changing activity levels throughout the day. Lastly, listen to your body. So often it's that last time down the ski slope, the last couple of minutes of the basketball game where you're hurting, where you're tired, but you decide to push through, that you unfortunately have that big injury. So make sure if you're tired, you listen to your body and skip that last run.
If folks want to learn more how you all can help them with these things, where should they go?
Sure, we have a website. It's www.mdbonedocs.com.
Dr. Zade, thanks for your insight. Thanks for what you do
Thank
for our
you
athletes
again.
out there.
Thank you.
All the best.
Have a good day.